Thank you everyone so much for joining us for the second session in the Western New South Wales Primary Health Network and Western New South Wales Public Health Unit's Partnership, Aboriginal Health and Wellbeing Education and Networking Series. Today's session will focus on influenza. And it's lovely to see you all here today. Thank you so much for joining us. Just as a little bit of housekeeping, everyone is on mute, but we certainly welcome you if you want to ask a question or have a discussion. Please come off mute and speak to the group. We'd also love to see all your smiling faces. So if you can turn your cameras on, we welcome that. But we understand also if you can't do that. If everyone can put their first and last name in the chat, we do capture it on Teams, but it's really just so that we make sure we've got everybody accounted for. This is an accredited session with NATSI-WIP, so yeah, it's really important we capture everyone who's here, particularly if you're all in a room together. We're recording the educational component of this meeting, and then we'll stop the recording for the yarning session just so everybody can freely speak and have a fantastic conversation, and we can make that recording available to anyone who isn't here today or who might like to watch it for a refresher following up. And your feedback is always super important to us. So at the end, there'll be an evaluation. If you can take a little bit of time to fill that out, we really appreciate all your thoughts and insights. So for some introductions today, the presenters for today's session are Kathy Hallahan and Kendall Ball from the Western New South Wales LHD Public Health Unit. Joining Kathy and Kendall for the Q&A session will be Belinda Tracy, also from the PHU, and Trixie Watts from the PHN. Our yarning session will be led by Wendy Holmes, and I'll now hand over to Wendy for an acknowledgement of country. Thank you so much, Wendy.
You're on mute, Wendy.
Sorry. I want to acknowledge the traditional custodians of our country throughout the Western and Far West New South Wales. I pay respect to elders past, present and future and acknowledge their continuing connection to land, water and community. I extend the respect and a warm welcome to all Aboriginal Australians present today. Thank you everyone for joining us. Please now welcome Kathy and Kendall to present today's influenza session.
Thanks, Sis.
Thank you so much, Wendy, for that. Welcome to country. I'm coming from Wiradjuri Nation today, and I'd also like to pay my respects to elders past and present and emerging, and celebrating the diversity of the Aboriginal people and their ongoing culture and the connections to the lands and waters of all New South Wales. Thanks so much for joining us today to talk about influenza. We are coming into influenza season, and I think it's hit us a little early this year, so it's a good time to be bringing up this topic. We'll go on to the next slide, thanks. So I just wanted to go off track a little to start with. I just wanted to bring you into our season. So currently we are seeing influenza, as I just said. There's 167 cases of flu that have been notified year to date in Western New South Wales, of which 16.8% of those are Aboriginal and Torres Strait Islander people. I think 63% are not, and 20% we're not quite sure, they haven't identified. So flu season is well and truly upon us, and so just knowing that is really important. It helps us to understand when flu season starts and when it finishes so that we can prepare, and I think that that's a key. So what's flu? It's a respiratory illness and it's caused by the influenza virus. There are two main types, flu A and flu B. Flu A is what we're seeing currently circulating, and there is some, I think, theory that B is a little bit more severe than A, and that has been in the past, but there's many different subtypes and strains, of which there's too many to go into today, and there's new ones being recognised every year, some more serious than others, and some that we've seen long ago but are emerging again. It's more serious than the common cold, and severe cases can result in people having difficulty in breathing, and it can go on to cause, illnesses like pneumonia, which lead to hospitalisation. And unfortunately, people of any age can die of flu, a flu-related illness. I think that's important because the very young and the very old are susceptible to this. And yeah, I think we've all heard in the media of cases of babies, young people dying, and of course, older people, also, people middle age, young adults dying of flu. And it can occur throughout the year, but it is most common in autumn and winter. So leading up to winter is when the flu campaign is released. In most flu seasons, there is more than one circulating strain in the community, and that is how we determine how the vaccines are made up. We look at where the flu's been before it comes here, and they get that information and make the appropriate vaccine to match what we're seeing in other countries. So it's a process every year, and that's why we have to be vaccinated every year, and that's really important. We'll go on to the next slide, thanks. So what are the symptoms of flu? So people with flu can experience the following symptoms: fever and chills, cough, sore throat, runny or stuffy nose, muscle aches, joint pains, headaches, fatigue, which is feeling really tired, not being able to get out of bed, not just, tired because we've had a hard day, but this is that exhaustion where you just can't get out of bed. Sometimes people can have nausea, vomiting, and diarrhea, which is more common in children than adults, but not to say that it can't happen in adults. And I think sometimes that throws people when you hear people talking about flu and associated nausea, vomiting, and diarrhea, because we often think flu is just, an illness that affects us, our respiratory symptom. So other people get very sick from flu and may have complications such as lung infections or severe breathing difficulties. And that can happen, initially when people are infected with flu, or it can be some time after people recover from the initial illness and then get what we call a secondary infection and then lead to hospitalisation and complications. These complications can occur in anyone, but what we see more commonly is that they do occur in people with a high risk of severe illness. Next slide, thank you. And so who is at risk of severe illness? So while we can all catch the flu, most of us get sick and we get better, okay? Within about 5 days, people, recover and return to their normal activities. But in some people, babies under 5 years, babies and children under 5 years of age, people aged 65 years and older, Aboriginal and Torres Strait Islander people, pregnant women at their last month or stage of pregnancy, and people with certain medical conditions. I won't read all of those out. And also people that aren't living at home or living in aged care or long-term care facilities may be at increased risk. Now, the reason why these people are increased risk is all of those subset of people have a compromised immunity. So when babies are born, children up to age 5, they're developing their immunity. So they catch everything that's going around. I'm sure you've all got kids, grandkids that are at childcare, and you know, they're coming home with everything. So they're at that age where they're just going to be susceptible. So that puts them at that age group. Again, people 65 years and older, as we age, our immune system is compromised just due to the aging process. Aboriginal and Torres Strait Islander people have more complex medical conditions, diabetes, heart disease, which puts them at risk again of an immune compromising condition. Compromising their immunity due to the condition that they've got. And again, pregnancy, your immune system is compromised due to your baby growing, and it's, you know, really, I suppose, taking a lot of extra energy to grow that baby. And so again, there puts you at risk of not only flu, but all of the other circulating viruses. And I think people living out of home in rough conditions are susceptible to getting flu, but also more susceptible to being really unwell with flu. And then just leading into aged care and long-term care facilities, the more people that are grouped together in a home with those comorbidities are also more at risk of severe complications, but also spreading the virus. I can see somebody's hand up.
Dan's hand's up. Kathy.
Dan.
Sorry, I was just sitting there, just gone through COVID and all that sort of thing. With the severe COVID, a patient experienced a severe COVID episode. Would that put them in that high risk area as well? It's just sort of thinking in that area as well, just sort of in that COVID space, since we've just sort of come out and it's still quite around and prevalent amongst our communities.
Yeah, Dan, really good point. And that is 100% with all illnesses and anything that we're circulating in the community. All of the people that are listed here are, you know, susceptible to especially COVID and also flu and all of those, you know, infections that we see throughout the year. So really good point. Okay, next slide, thanks. And the other thing I hear all the time, how do I know I'm sick with flu or cold? And I've just included COVID here. So the thing with COVID, and the thing that I think there's nothing good about COVID, but there has been a lot of changes in our health system due to COVID, which has helped us to quickly identify what we're sick with. And one of the biggest changes is antigen testing and being able to do that rapidly. So we can do a test now where we can basically instantly find out whether we've got COVID or flu or RSV. And that's really, I think, a good place to start if you're unsure. So otherwise, what I like to say is, and there's a list of things in the table there where we have COVID versus influenza versus cold, and you'll see the symptoms, the onset, fever, all of those things listed. COVID-19 and influenza, they're quite similar in their presentations. There's just a few of the symptoms that may not be present in influenza but are in COVID. Whereas your common cold, those symptoms aren't as common. And what I like to say with regard to what do you think I've got, the flu or a cold? Well, think about it like this. A cold is usually in your head. It's usually respiratory. It's a blocked nose. It's a sore throat, and it stays in that area. It might come to your chest and it might give you a bit of a cough, but it usually stays up around your head. Whereas your respiratory influenza, it's actually affects all of your body. So it affects your muscles. It affects your gastrointestinal tract. It affects your upper respiratory tract, but it's an overall illness. And I think that's the biggest difference is the flu affects all your body. A cold affects usually just your upper respiratory tract. So there, I think, are some, good maybe take homes just to think about what is this. If you don't have access to a test, there's some of the things you can think about. Quite often you hear people when they get the flu, oh, it hit me. It hit me. Hit me like a truck sort of thing. And the first thing they'll say is, cold shivers, shakes, that sort of thing. And you are sick, really sick. You hear that. People talk about how sick they are. Whereas when you got a cold, you tend to soldier on. You take some Panadol, you take something, and you're usually okay. You can still go about your day. So there's just some, I suppose, good comparisons and to think about that. But testing is the key. Next slide. When should you go to hospital? So if you've got a common cold, you're not going to go to hospital, because really, unless it develops into something like a secondary bacterial infection, a flu is going to present in a different way. Some of the key points here as to when you should present to hospital, or if you're looking after people and they're experiencing these symptoms, tell them to present to hospital, is difficulty in breathing or shortness of breath, chest pain or pressure, sudden dizziness or confusion, severe or persistent vomiting, and flu-like symptoms that improve but then return with fever and worse cough. So that's sort of saying to me that you might have started off with, flu-like symptoms that may have been, as I said before, a common cold, or it could have been the flu, and then a week later you're still not better, and you start to develop, a cough, and you start to get those temperatures back. That's a key indication that you more than likely have a secondary bacterial infection, and that you need to get checked out, because that's when we talk about the pneumonia and the complications that come with a severe influenza infection. So the symptoms can indicate a more severe case of the flu or complications which may require medical attention. And if you're unsure whether your symptoms warrant a call for help, it's better to seek advice. I just think you need to get checked out, and make sure that everything's okay. That would be my advice. Next slide, thank you. So what are your treatment options for flu? And this is, I think some people may benefit from a flu antiviral to speed recovery. So antivirals, antibiotics, there's a big difference. And it's really important that antivirals treat viruses. They stop the virus from replicating in our body. That's how they work. Antibiotics stop infection from multiplying, so they kill bacteria. So two very different things. Antivirals help to, as I said, stop the virus replicating. So people tend to not get sicker. They stop the illness, I suppose, in its tracks a little. Especially if they have complications, it is important that we get antivirals. People tend to recover a lot quicker after they've started antivirals. And also, it's really important to know, if you've got access to antivirals, that you've got to start them in a certain time, which is recommended 48 hours after the symptoms have developed. The reason being is we're trying to stop that virus replicating, so we want to do it as quickly as possible. They're not sold over the counter. You've got to get a prescription. So it's something that, if you've got those high risk factors we discussed, it might be just something you have a chat with before your clients or your people that you're seeing, your community. Just say, hey, have you heard about antivirals? Do you want to go and see your doctor and have a chat? Because they can sometimes make a plan up as to what the best course of action is if you were to develop flu and you need to get access to them. So talk to your doctor and see if the treatment is right. Next slide, thanks. When should I get treatment? So I think, again, we're going through that risk group, the group that have the complications due to their immunity being compromised. But also, when I think you are working in a space that, you're looking after people that have these issues is really important, especially working in a nursing home. So if you get sick with flu and you receive treatment, not only will you get better quicker, but you will also be less infectious to other people. And that goes for people that are in nursing homes. So when we look at outbreaks, one of our roles in public health is to manage outbreaks, influenza outbreaks in nursing homes. And one of the things we do is recommend that those clients within the service get access to antivirals. And what we do see, and we see this quite often, is they recover quicker and they have less complications and they're not as infectious. So it tends to stop the spread. Again, anything to do with antivirals, you need to talk and get more information from your GP. Next slide, thanks. So to protect yourself and to protect others, what can you do? So if you're sick, stay at home. I think that's our mantra now, isn't it? We're being given permission to stay at home when we're sick. And that's another thing I think COVID has brought to us. It's given us permission to stop and stay at home. I think we're all well aware before COVID landed on our shores, we did tend to soldier on and go to work at all costs and expenses, or hang around and go out, do what we need to do socially without giving it much thought. But I think COVID's made us stop and think about that a little bit more. But then that also, the measures that we put in place for COVID. Sorry, did someone have a question there? No. So I think with those measures that we're all so well aware of now, we need to, if we need to leave home, put a mask on. It just, it's the best weapon we've got. Wash our hands, use soap and water for 20 seconds. If you don't have soap and water, get that alcohol, rub onto your hands and give it a good going over. Also, when you sneeze or cough, teach that coughing into your elbow, and discard tissues and stuff into the bin. Washing your hands. I think we've got access to that everywhere now. And cleaning's a huge thing. We just need to wipe that virus away, get rid of it, so that somebody doesn't touch that doorknob and then touch their nose and basically get, influenza or any other respiratory virus that's circulating. Next slide, thanks. So what can you do to protect yourself from serious illness or hospitalisation or worse? Get vaccinated. It's that simple. So there's lots of information coming your way from Kendall. And so I'm going to hand over now to my colleague Kendall to take you through influenza vaccination. Thanks so much, guys.
Hi everybody, I'm Kendall. I also work at the Public Health Unit. I know a few names on the screen, so it's nice to see you and nice to hear some new names too. Next slide, please. So I'm going to talk to you about immunisation, but I just thought that this was a really good slide just to show you how prevalent flu has been last year and this year. So looking backwards, 2019 was our massive year for flu. It was huge. So if you see from the slide in the totals over the right-hand side, there were 313,615 cases of flu. Funnily enough, last year was our second biggest flu season. So there was 288,000 cases of flu in Australia last year. So if it's felt like a big season, it actually was. what we've sort of found this year is that the flu it died down a little bit between last year and this year, but there's always been a higher than normal circulating rate. So if you look at January and February, in January 2023, there were 4,000 cases of flu. In January 2024, we had 9,000 cases in Australia. So I think that just goes to show where we're at the moment, and we're tracking a lot higher than previous years. If you look at March, we're not finished March yet, but to the 18th of March, there were 5,000 cases of flu, and last year there was 9,000 for the whole of March. So yeah, I just think this year we might be tracking for a big season. So I think influenza vaccination is probably a really important thing this year, as it is every year, but to put it into perspective. Next slide, please. So these were our flu vaccination rates for everybody in 2023. So this is the data up to the 3rd of September. So that's across flu season. So all children aged 6 months to 5 years. In New South Wales, we had 26.8% vaccinated. In Australia, we had 28.3% vaccinated. And in Aboriginal and Torres Strait Islander populations in New South Wales, we had 18.4% vaccinated between 6 months and 5 years. And in Australia, it's 19.7% vaccinated. For older Australians over 65, we had 60.3% vaccinated, and in Australia we had 63.1% vaccinated. Aboriginal and Torres Strait Islander over 65 years, it was 64.3% in New South Wales and 61.4% in Australia. So really good. I think what this goes to show is that over 65 we get some fairly decent vaccination rates for over 65s, and that we've got a lot of work to do in the 6 months to 5 years old cohort, especially in our Indigenous population. We need to probably make it a bit more available to them and get those rates up. For some reason, people just don't have it on their radar across Australia, across New South Wales, to get their children from 6 months to 5 years vaccinated for the flu, and we probably need to make that, you know, a real discussion point when they're receiving their childhood vaccinations during flu season. Next slide. So what's the government funding this year? So there's 2 vaccinations for 6 months to 5 year age group. There's one now, you will see other vaccinations out there depending on the private market as well. So this is just for the government funded vaccines for all those cohorts that are eligible for free vaccines. So 6 months to 5 years, there's 2, 5 years to 64 years. There's 1 vaccine, and over 65, we've still got the Fluad Quad. So it's got extra adjuvants in it to help the immune system of the over 65s along. It's not actually a stronger vaccine, it's just got more in it to boost the immune system a bit more. Because as we know, when you get over 65, your immune system doesn't work as well. Next slide. So this is a lot of letters. This is just basically saying this is what the flu vaccines are covering this year. These are the lineages of the types of influenza that the vaccines are covering this year. So they're all of the vaccines have 4 strains of the flu in it. It doesn't matter which age group you're in, they've all got 4 strains of the flu. It's just the only difference is in the over 65s, it's got the extra adjuvants to help the immune system along. Just one thing I wanted to point out. So next year there might be a big change in the flu vaccine. So there's one of the strains of the flu that they haven't detected for a couple of years anywhere in the world, and that's the Yamagata. That's an influenza B strain. So next year they may look at taking that out of the flu vaccine because they haven't seen it. And sorry, a phone call's coming through on my phone and it's beeping on my headphones. So what they might look at doing is either taking that out and only making it a 3-valent vaccine, so with only 3 types, or they might look at replacing it with another type of flu in the vaccine. next year. So watch this space. It may change in the next 12 months, depending also what happens in the Northern Hemisphere in flu season. Next slide, please. Okay, so the best way to avoid flu this winter is to get a flu shot, and this is how you can get your flu shot. So free flu shots are available for all Aboriginal people aged 6 months and over. This is because Aboriginal people are at greater risk of severe illness from influenza, as Kathy has already talked about. Flu shots are especially important for pregnant women. It can prevent serious illness, admission to intensive care, and even death in the mother if she's pregnant. So when you're pregnant, you have reduced lung capacity, you're trying to support another little person, and if you're 36 weeks pregnant and you've got a big belly, you don't have many lungs. All of you women in the on the meeting would know how hard it is to breathe when you get to the end of pregnancy if you've had babies. It's really important that pregnant women get flu vaccine to prevent them from getting the flu in the first place, because it's really hard if they get it when they're pregnant. It can also help protect the baby for the first few months after the baby's born. So when you give the mother a vaccine, it goes through the placenta to the baby, and that gives the baby antibodies. And also, if the mother's had a flu vaccine and they're breastfeeding, there's also antibodies given to the baby that way as well. You can book an appointment for a free flu shot with your doctor, pharmacist, or Aboriginal medical service. So there's a lot of pharmacies out there this year giving flu vaccines, quite a larger number than normally would be giving flu vaccines. So they're widely available. So there should be somewhere where you can get a flu vaccine. Everybody can get a flu vaccine. The only little thing with pharmacists is that they can only give the flu shot to children over 5 years old, and if you have a child under 5 years old, you'll need to see a doctor about that. Children under 5 years old, like we said, have a different flu vaccination available to them, and if it's their first time having the vaccine up to 9 years old, they'll need a second vaccine. So you have 2 vaccines within the first month, the first time you have the vaccine. So every year after that, you only need 1. Next slide, please. So this is just a little video
Influenza
for people. So yeah, run the video and
commonly
just give
known as
everyone
flu, is a serious illness that can make our mob really sick. A flu vaccination will help keep you and your mob strong this winter. I encourage you to get your free flu shot as soon as possible. Flu shots are free for all Aboriginal people aged 6 months and over. Don't wait until it's too late. Book an appointment today for a free flu shot with your doctor, pharmacist, or Aboriginal healthcare worker.
So that's just a little video that you can share with, and the links to these things will be in the slides after the presentation. Dan's put a comment in the chat. We'd like to, Dan. That's a question for Belinda.
So I'll just butt in there. So Dan has mentioned that there was a great success with the pop-up vaccination clinics when the vaccination rates needed lifting. Is there a plan to offer these again in rural and remote areas? Oh, if we could just have cut out people just all over the state offering these vaccination clinics, that would be great. Basically, yeah, we are engaging in all those kinds of chats, Dan, and the problem with pop-up vaccination clinics, they're great for the day, but they don't support the people that don't get there on the day. So we're actually really encouraging our pharmacists and our GPs and our AMSs to really step up, and who have got that long-term relationship with everyone in the community, so that there's just that ongoing connection with service providers and other vaccines as well, not just influenza. So I am looking at it. If we identify an area of great need, I will certainly, try and do my best to create some sort of access to vaccination. So yeah, I suppose that's my point, is if you identify a community or a town in dire need of access to a vaccination clinic, please let me know or the PHN know, so we can, get our resources together and get that vaccine clinic happening. Back to you, Kendall, or are you?
Yeah, no, I'm still going. Okay, so who's eligible for government-funded vaccines? We've kind of covered this already. All Aboriginal and Torres Strait Islander people over 6 months of age, all adults 65 years and over, all children aged above 6 months to 5 years, pregnant women at any stage during their pregnancy. So even if they're only 11 weeks pregnant, they can still have a flu vaccine. If they're 39 weeks pregnant, they can have a flu vaccine. And people with a specified medical condition who don't fall into any of those other categories. Next slide, please. So this is just for reference. I'm not going to read through all this. This is available on the New South Wales Health website. There's quite often a lot of conjecture at GP practices, Aboriginal medical services, everywhere that gives vaccine. What is the condition? Does this condition fall into the category for flu vaccine? Does this condition fall in? There's always a lot of talk about it every flu season. So there is a list of medical conditions that fall under the category of having a government-funded vaccine, and it is available on the New South Wales Health website. Next slide, please. So why get immunised and how does it work? So all diseases we vaccinate against can cause serious ongoing health conditions and sometimes death. So we vaccinate against conditions that, can go on to cause chronic illness, can go on to cause increased costs to the health system. So we vaccinate to prevent. We try and get ahead of the pack, and we vaccinate to try and prevent the disease before it becomes a problem. Vaccines strengthen your immune system by training it to recognise and fight against specific germs. So we introduce a part of a disease, a part of a molecule, something that makes the body recognise that illness, so that when that body comes in contact with the illness, your immune system recognises it and starts to engage and shuts down the illness. If you've never come into contact with that illness before and your immune system doesn't recognise it, that's when you get sick. Vaccines work by producing an immune response in the body without causing illness. So when we introduce that vaccine to your body, it doesn't cause an illness, it just causes your immune system to recognise the illness. Vaccines use dead or weakened viruses to trick our bodies into thinking we've already had the disease. So that's how our immune system works. So that when you come in contact with the bug, it thinks it's had it already and it doesn't want it again. When you get a vaccine, your immune system responds to these weakened invaders and creates antibodies to protect you against future infection. It has special memory cells that remember and recognise specific germs or viruses. And the other way that vaccination works, so if we can get the majority of people vaccinated, we then get herd immunity, which everybody I think has probably heard about herd immunity, especially with the flu. So there's a certain cohort of people who can't have vaccinations for whatever reason. They're too young. They've had a reaction to a vaccine before, and they can't actually have a vaccine. So by getting really high vaccination rates amongst everybody else, it stops the disease from circulating, which then prevents the people who can't get vaccinated from from getting sick with the disease, because they're just not being exposed to it. So that would be that 0 to 6 months age cohort, which is a really high risk category, young babies with low immune systems. So plus other people as well. Next slide, please. This is just a copy of the New South Wales immunisation schedule, which I actually haven't put the Indigenous version on here. I'm very sorry, I put the wrong one. But that was updated in October 2023. So that's the latest version. And down the bottom, it has a little blurb on influenza vaccination as well. But this is just what children should be receiving. And of course, there's other vaccines on there on the Indigenous version. I apologise profusely for putting the wrong one on there. Next slide, please. So here's the Aboriginal immunisation brochure. This is available from New South Wales Health. If you wanted to, I think, can you order it, Belinda, or you just print it out and give it to people?
We can order it, but yeah, because we've personalised it now that Alice has left us, I probably need to amend that.
Her name's still there.
Yeah. Yeah, you can certainly print that off.
Yeah, and it just gives a little bit of information about vaccination, and what, just sort of gets minds ticking over and thinking about it, and gives them some places where they can go to get more information if, if they're unsure about vaccination. Next slide, please. This is another resource that you can use. This is the NC's vaccination information sheet about influenza, why you should get the influenza vaccine, common myths about vaccination. And there's also, at the end of the talk, there's a link to all of these websites, and there's other really great links to resources to help have that conversation about influenza vaccination, COVID vaccination, and all the other vaccinations as well. Next slide, please. So these links, there's some here too. So the New South Wales Health Respiratory Surveillance Report, that's just for your information. That's quite a data heavy document, so we didn't put it in the talk today, but it's got some really good information about, RSV, COVID, influenza, all of the respiratory illnesses, where they are. You can filter it to your area health service, just to see what's floating around at the moment, and that's on the New South Wales Health website. But that's a really handy link if you sort of, you have people go, is there a lot of flu getting around? You can have a look. Is there a lot of RSV getting around? You can have a look at that. Infectious disease data, New South Wales, that'll also provide you with some similar statistics, and it will also provide on some other communicable diseases as well if you're interested. Flu tracking is an online health surveillance system used to detect the potential spread of influenza and COVID-19. The NC's website, so it has really good information about flu vaccine coverage, and the NC's website also has a lot of resources for all of the vaccines and how to sort of talk about all of the vaccines, who's eligible for the vaccines, research around the vaccines. So if somebody comes in and says, I've heard this about the vaccine, it's a really good website to go to find the evidence and the research studies to back up the argument, to give them the information about what they're asking. 24 flu season vaccine information, that'll give you the information about the actual vaccines, and NC's influenza frequently asked questions, which is a great site for, usually the people that come and ask you the questions have been asked before, so you can head to that page to answer the questions. Next slide, question time.
Brilliant. Thank you, Kendall and Kathy. So this is time to ask questions and explore all of these new things or old things. So please don't hesitate to hit us up for some information. So the floor is yours. Dan.
I know people are going to be sick of me by the end of this session.
Not at all, Dan.
I was just, is there any sort of, we had quite a large communication thing about influenza and stuff during COVID as well. Is there any plans to sort of up that communications in these communities right across the LHD?
I think we're going to be swamped with a lot of information. Given the stats that Kendall and Kathy have just provided, we're very nervous about the upcoming season, or the season that we're currently in. I think we're waiting for the ministry to really formulate some excellent communication packages targeted towards Aboriginal communities, as well as general population. So there's certainly some information out there at the minute for, health professionals to access. But for general communication, I've been on a couple of meetings, Dan, and they're making sure that they get onto all the media that's traditionally used in our Western areas as well, in Paja and that sort of access as well, not just on Facebook or Instagram. So if you think there's an opportunity to spread that media message that we might have missed, please let me know. I can certainly talk to our communications team to broaden that scope.
No worries, Belinda.
And I think, sorry, Dan, I think they're also trying to be a little bit strategic when they release it by the sounds of things. They don't want to release it too early and have people sort of hunting for a flu vaccine when it's only just being distributed as we speak. So I know a few places who have got it. So I think they're trying to be, so it'll be released a bit later so that when people hear about it, they can get the vaccine straight away.
Oh, perfect. Just from my own personal view, is the sort of some of the communications this time, are they going to be very fluffy and nice, or are they actually going to state what's going on? Because a lot of the communications that have been going out lately, and please, anyone in the group, please jump on me if you feel that I'm going in the wrong direction, but a lot of our communications lately have been very fluffy and softly. Some of our statistics for these areas are actually quite alarming. And to be sort of going along with this softly approach when we're understanding we're most probably one of the toughest countries and some of the toughest people on the planet when it comes to actually being able to be resilient with people comment and things like that. So I'm just wondering if there's a consideration of actually trying to have a bit more impact and sort of with our communications, because a lot of them lately have been very and please apologise if I'm being offensive to anyone, but very fluffy sort of stuff.
I agree, Dan.
And
I agree.
Yeah, from what I've spoken to at the ministry level, I think they're probably going to be still using the images like my background to sort of promote things. But I think on a local level within our district, I think it's worth us, coming up with something more robust. We might not go to the Grim Reaper of stop smoking level, but, maybe we need to, just be really factual about the potential of influenza and deliver the hard but truth message of the risks. So
I'm only just saying that, Belinda, because I've actually just shown my kids a video about one puff and you're hooked, the actual original stop smoking video, and I think that was pretty much enough to put them on the line of not actually touching a cigarette. So
that's it. And I agree with you. Yes, we are resilient, so we can take the truth.
And I think at your, at our level too, we might not control the communications, Dan, but also you can be blunt with people as well and say, well, this is what flu does. And I know you're not going to come in contact with every single person, but even the people that, maybe if you tell one person, they'll go and tell one person. So we can also be very truthful in the information that we impart as well. Flu is serious and we need to get vaccinated.
Dan, also, the
Your speaker.
I'll put my speaker down. The information that we've put on the resource page, that's another tool that you've got, is to access that information to see what's happening in your patch with the flu numbers. And, having that knowledge is going to give you, I suppose, permission to go out and do what you need to do and talk to your people about what you're seeing. It's easy to access. It's easy to put in a date, a time, and see the numbers. And also I just wanted to talk about the flu tracking. Is anybody online actually hooked up with flu tracking or signed up? Someone's hands up. Fantastic, Pam. Did you want to talk to that just a little bit?
I've been doing that for probably 10 years or more now.
Yeah.
And I include my family, and I started when I was working at John Hunter's, and I've continued it since I've moved out west.
And do you know and can access the reports on flu tracking? They've got some amazing data that they can pull, and it's voluntary, so people can sign up, answer the questions, and they're really one of the really robust resources that we have every year. And yeah, I would just encourage people to click on the link that's within the resources and have a look at signing yourselves up to flu tracking, because that's what's going to help you know what's going on in your community, so that you know where you need to target that information quickly.
Correct. Yep.
I'll see if I can add a link to flu tracking in the chat as this continues.
The flu tracking link, I think, is in the slide, isn't it? Can't hear you, Kath.
Yeah, I think added in the chat, but I can look at the same time too.